Hello, I'm Jason Oberste. I'm an orthopedic surgeon, and I've been here at Capital Hospital for over a decade. I'm so glad that you're here to listen and learn about our joint replacement course. We are very excited that you're here. I just want to give you a time to really understand what we do here with joint replacement. I want you to feel comfortable about your decision. It's an excellent decision. Joint replacement is likely the most successful surgeon that we do, definitely in orthopedics and maybe even in all of medicine. And the reason that I say that is because I believe that when you get your joint replaced, you go from being nearly limited in many of the things that you like to do to becoming a person that can be athletic, can regain their function, and not think about their joint every day because of the pain that you are suffering. Joint replacement is miraculous. I've probably done over 10,000 joint replacements over the course of my career. It's something that I love to do, and I think that here at Capital we do a very good job of giving you different options in regards to how your joint plan can proceed. We have multiple surgeons that are very well trained that really enjoy doing it just as much as I do. One of the things I really like about what Capital offers in regards to joint replacement is that we have a very comprehensive program that allows you to come and learn about your surgery before you actually proceed, to become familiar with the facility. There are so many people involved in making sure that your experience is comfortable, comprehensive, and completed in a manner that should meet your expectations. One of the things I really like to talk about as well is the fact that Capital has allowed us over the course of my career, which, as I said, has been many years. Capital has really allowed us to learn and evolve with the technology that is available in joint replacement. Many people have likely heard about the fact that we can use navigation and robotics and the cutting edge materials that are involved in joint replacement. I think it's at this point the materials should and do last for essentially the rest of your life. They should. Usually the only time that we have problems with joint replacement is if there's some type of complication that usually involves illness or infection, and those numbers are exceedingly small and continue to diminish with time as we improve our protocols with antibiotics and cutting edge dressings that allow your incisions to heal quicker and safer and sooner. And I really believe that Capital has given us all the tools for your surgeons to really feel confident that we are giving cutting edge care to the North Florida region. One of the exciting pieces of technology that I currently am using is robotic knee arthroplasty. And some people are like, whoa, robotics, does that mean that the robot is doing the surgery? Absolutely not. What we are doing is we are taking advantage of the precision of a computer and the precision of the device to allow us to put in a joint replacement that as closely replicates your body's design as possible. Make no mistake, the surgeon is still in charge of every decision that happens within the surgical procedure, but the robotics are a tool that really helps our precision. I've seen significant improvements in return to activity because of the technology that has diminished the amount of soft tissue incisions are smaller, surgical times are less, and all of these things go into a much more successful outcome for you when you're getting your surgery. Other things I'd like to talk about is the staff and at Capital that is really involved in our joint replacement program. You can't ask for a better group of people that are also fully invested in making sure that your stay and your surgery go as smoothly and as perfectly as we possibly can. Those people involve the staff that greets you, that makes you comfortable when you come into the facility. Make sure that it's easy for you to enter and exit. Make sure that your family is comfortable while they are waiting. After that, then you have your nursing care that makes sure that you're completely safe and prepared for undergoing a very complicated procedure. We also have multiple people in the anesthesia team that understand the advancements in how your anesthesia can be given. That can be what most people are comfortable with, which would be going to sleep, up to actually staying awake during your surgery and have regional numbness and what we call nerve blocks that allow you to be able to breathe on your own and enjoy a nice, comfortable surgery without actually going to sleep. Your anesthesia providers here will give you those options and talk to you about what's best and what's safe for you. And then you have your post-operative nursing care that is some of the best that I've ever been around. Very thoughtful, very caring, and very, very good communicators with not only the patients and their families, but also with the surgeons and the surgery staff. It's very important that we're all in communications together, and it just is I would call it a family. The family here in our joint replacement program makes all of you as patients comfortable, your family comfortable, and it also makes the surgical staff comfortable as well, which goes a long way into a very pleasant stay, a pleasant experience, and a safe experience. So I want to thank you for coming. I look forward to maybe seeing some of you in my clinic and in my operative suite, and I think you will not regret coming to Capital for your joint replacement experience. Thank you very much.
Welcome to your Total Joint Education class. I am Casey Antrobus, and I am the Orthopedic Navigator at HCA Florida Capital Hospital. I will be a guide and a resource for you through your hospitalization and your orthopedic procedure. When you come in the day of your pre-admission testing surgery appointment, you will actually get this Total Joint booklet. So this booklet is a guide for you to utilize when you actually have surgery. So it gives education for you, and it actually helps prepare you for what to expect before your surgery and after. There is a section in the back of the book that will actually show you where you can write notes. So if you would like to take notes while you're here, that you would like to ask your surgeon specifically, it is just kind of a good area to jot that information down. So please make sure that you bring it to your preoperative appointment as well as with you to the hospital. So what is the goal of this class? We want to provide you with a team approach through your surgery and your recovery. The most important part of the team is you. So your commitment and cooperation are vital to a rapid and successful recovery. So these are some of our surgeons that operate here at the hospital that do provide total joint replacements. So first we have Dr. Brian Zergabel, then we have Dr. Jordan Walters, Dr. Roll, Dr. Chad Durgan, Dr. Bradley Walter, Dr. Jason Oberste, and Dr. Corey Messerschmidt. So who is a part of your team while you're here at the hospital? You also always have your orthopedic director, manager, me, the spine navigator, your RN, your LPN, your assistant staff, including your PCT and CNA, your medical provider, your physical therapist, your occupational therapist, if ordered, your case manager, your pharmacist, your dietitian, and your environmental services that will help keep your area clean. So, what are your responsibilities? Your responsibilities are to read and follow your preoperative instructions sheet thoroughly, use your patient handbook and guide through every step of your surgery, and most importantly, ask questions. If you are unclear of anything, please don't hesitate to ask.
Hello, my name is Lisa. I'm one of the registered nurses here at HCA, and today we will be discussing pre-admission testing and what to expect. Where do you arrive? TOC schedules your pre-op appointment with HCA. TOC or HCA will notify you of your pre-op phone and or in-person interview. If you have any questions or have not been notified of your pre-op appointment, please call 850-325-5376. Where do I go? You will arrive to the front entrance of HCA Florida Capital Hospital. At the front desk, there will be a security guard that will direct you from there. What should you bring? Government issued ID and insurance card, any provided paperwork from your doctor's office, a list of your current medications, any cardiac records, for example, EKG, echo, stress test. What can you expect from your pre-op appointment? Well, your pre-op appointment can last up to 2 hours. The nurse may call you at home. When you do arrive to the hospital, she will get, or he or she will get weight and vital signs, possible urine specimen collection, lab collection, obtain a formal consent for the procedure, chest x-ray if it's indicated, an EKG if it's indicated, medication review, obtain medical history, pre-op instructions will be reviewed, nasal swab, pre-op surgical wash with instructions, and answer any questions or concerns regarding your procedure. For example, some medications to stop. Medications such as diabetes medications, for example, glimepiride, metformin, blood thinners. You'll stop taking blood thinners such as aspirin, warfarin, Eliquis, ibuprofen, naproxen, Plavix. Your physician will instruct you on how many days prior to stop these medications. Water pills and diuretics, examples, furosemide, spironolactone, Bumex. Continuing taking blood pressure medications, for examples, amlodipine, metoprolol, carvedilol. On the day of surgery, arrival will be 2 to 3 hours prior to your scheduled procedure time. The time will be provided by calling this number, 850-325-4571 after 6 p.m. the night before your procedure. On the day of your procedure, you're going to proceed to the second floor and check in with surgical waiting room secretary. At the time of your pre-op, they will start an IV. The nurse will come in and greet you, start your IV, review consents, and verify information from your pre-op appointment. Multiple verifications of identity will be confirmed throughout your hospital stay. You will also meet anesthesia and they will interview you as well. The surgeon will arrive and evaluate, mark the site, and answer any last-minute questions. You will be monitored in the pre-op bay until surgery with one family member allowed. You will be introduced to your OR team and escorted to your operating suite. At that time, your family member will be in the surgical waiting area and they will be provided with updates on your surgical progression. If any surgery times are updated, you will be informed promptly. Following surgery, you will be recovered in the PACU. Following recovery, you will be taken to same-day surgery for same-day discharge, or if you will be staying overnight, you will be given a room assignment.
Hi, I'm Nadia Javier, one of the physical therapists here at HCA Acute Care Physical Therapy Unit. And today, I'm going to discuss the importance of physical therapy after joint replacement, the movements that you need to avoid after hip replacement, and the adaptive equipment and tools that are beneficial after your joint replacement surgery. So let's get started. Hip osteoarthritis is the leading cause of disability in elderly patients. It has a considerable impact on patients' activities of daily living, qualities of life, and general health status. So total hip replacement is the only definitive treatment for the end-stage symptomatic hip osteoarthritis, aiming to relieve the pain and restore the normal joint function and independence. As you can see here, we got the prosthetic hip. We have the femoral component, which is composed of the ceramic ball with a metal stem that is inserted in the femoral thigh for stability, and the metal cup that is attached to the hip joint, which is called the acetabulum, to allow the smooth rotation of the prosthetic hip. We have two different types of approaches for hip replacement for surgery. We have the anterior approach and the posterior approach. The anterior approach is where your surgeon makes an incision near the front of the thigh in order to remove the damaged cartilage and bones and allow the implantation of the prosthetic hip. And the posterior hip approach is where your surgeon makes an incision behind or beside your hip joint. It goes through the muscles and tendons to remove the damaged cartilage and bones and allow the implantation of the prosthetic hip. So as we always emphasize, walking is the best exercise. After your hip replacement, you will be placed in a same-day surgery unit where we conduct our physical therapy evaluation and assessments. We assess the integrity of your muscles to make sure that you are safe to get up and ambulate. And we also educate our patients on how to get on and off the toilet safely. If you have stairs at home, we want you to make sure that you will be able to navigate your steps safely by training you here at the hospital. So from bed to walking, that is our goal. Hip replacement precautions. We want to emphasize the importance of hip precautions after your hip replacement. Do not twist your hip inwards or outwards. Keep toes pointed forward. Do not cross your legs. Use a pillow between your legs when rolling. Do not bend your hip past a 90-degree angle, and no hip extension. So these are the pictures that you need to know, and this helps you and guide you after your hip replacement. Do not twist on your hips when turning around. Pick up your feet, performing small marching steps. At the same day surgery as well, upon evaluation, we also use an assistive device called a two-wheeled walker. So in this, we promote safety and it widens your base of support. Next is the knee replacement. As I always emphasize, walking is the best exercise. Here at the hospital, we encourage you to move around and walk after knee replacement. And early mobility begins operative day 1. First, you're going to sit on the edge of the bed. We use an assistive device called a two-wheeled walker. We use it as a tool to help you get up, transfer safely, and we do physical therapy evaluation and assessment. Knee immobilizer is often prescribed after your knee replacement if your muscle is weak enough to walk. To prevent knee buckling, we use knee mobilizer in order for you to have more stability with your transfer and ambulation. It must be worn at all times if it's prescribed by your surgeon while ambulating. Here are the adaptive equipment. We have the two-wheeled walker, the bedside commode, the shower chair, and the tub bench. So we discussed this equipment in order for our patients to get ready after their knee replacement.
Hello, my name is Jacob. I'm a social worker here at HCA Florida Capital Hospital with the Case Management Department. Case management's role in your planned surgery is that of the discharge planner. We start following you from just before you come in for your planned surgery and follow you every step of the way, all the way out the door to the time of your discharge. For most of our planned joint surgeries, TOC will have arranged for you to either have a home health care service or an outpatient physical therapy appointment after you discharge from the hospital. Our role is to help coordinate with those services and with TOC to make sure that the orders are set up for you by the time you leave. You can expect to get a call from either myself or somebody from our department, usually the day before your surgery, or if your surgery is planned for a Monday, the Friday before your surgery. Somebody from our department will call and check in with you just to verify some information, make sure we have everything correct on our end of things, and to check to see that you have the equipment that you need for your surgery. For any of our planned knee and hip replacements, a two-wheeled walker is a necessity. TOC will likely have one arranged for you, so to either pick up for your procedure or to pick up the day of your surgery. So we will call in, verify the information, make sure you're aware of your walker, and make sure that we have the home health care and outpatient services arranged as needed. If you do come in and discharge the same day, you will likely not see us. We'll be behind the scenes working on getting everything arranged for you. But if for whatever reason you do have to be admitted to the floor or stay overnight with us in recovery, either myself or somebody from my department will check in with you on the floor and follow you once you're actually admitted to the hospital as well.
Hi, my name is Veronica and I'm one of the dietitians here at HCA, and I'm going to be giving my talk on nutrition. So first things first, we're going to be trying to focus on planning ahead for after surgery. So kind of having things on hand such as crock pot meals, maybe making a meal and freezing it so that you have it after surgery. Having some quick snacks on hand such as nuts, yogurt, fresh fruit, carrots, or broccoli can be really good to have something to snack on after surgery that's kind of easy and quick and gets you some good vitamins and minerals. Another thing that might be helpful is something such as a supplement. So some common brands are Ensure, Boost, Glucerna, protein shakes. These are kind of easy things to have on hand that you can sip on throughout the day after surgery if you're not feeling too up to eating or cooking a full meal. Next, we're going to be talking about post-surgery. What are some things that you might want to keep in mind? So you might see that your doctor has you on a diabetic diet after surgery. We're not telling you you have diabetes. This just sometimes after surgery you might have elevated blood glucose levels because of stress and other certain medications, and this will normalize and will put you back on a regular diet afterwards. Another thing we like to have you keep on mind is that we have certain things on the floor for you to have in case your throat is sore, such as soft items like pudding, applesauce, some popsicles to kind of soothe your throat if it's feeling a little sore after surgery. And once again, this is something else that's going to normalize afterwards. Something else is there's certain food items that can be helpful with controlling inflammation and after surgery. And so I have a list here of different food items that have been shown to help with fighting inflammation. I always like to say, if you see things on this list that you already have in your diet and that you like, maybe trying to increase them a little bit after surgery is going to be helpful. Or maybe there's a food item that you see that you've never tried before and you're interested in trying, so maybe trying that after surgery could be helpful. If you see something you absolutely hate, I'm not telling you have to eat it. It's okay. So some example of foods that have been shown to help fight with inflammation are things such as fatty fish like your salmon and tuna, nuts such as almond and walnuts, flaxseed oil, onion, garlic, dark fruits like plums and berries, and turmeric. Another thing we want you to keep in mind post-surgery is getting enough fluids and fiber. This is going to be really important to make sure that you're having regular bowel movements and not getting too backed up. So things that have fiber in them are things such as whole grains and fruits and vegetables. So post-surgery, making sure you're getting in some good whole grains and some fruits and veggies can be really helpful with keeping you regular. Another thing is trying to get enough water. So our general recommendation is 2 liters of water a day. This, of course, is only if your doctor hasn't put you on a fluid restriction or anything like that. Always listen to what your doctor says. Something else that can be helpful, even if you do all of the things I've said, sometimes having a stool softener on hand can be good, just in case. We don't want you coming back here because of constipation. Something else is after surgery, what are some good nutrition tips to keep in mind? So one is getting enough protein foods. So high protein foods are going to be high in zinc, which is really good for fighting infection. Protein, of course, has some essentials for maintaining and rebuilding muscle, so it's going to be really important after surgery to make sure you're getting enough protein. Some foods with protein are going to be your different meats, your poultry, dairy, eggs, fish. If you're not a big meat eater, there are some sources of non-animal foods such as nuts and seeds and tofu that contain protein. So sometimes we try to get enough protein and maybe you're just not feeling up to eating a full meal. This is when the things such as the supplements like an Ensure or Glucerna can come in hand to try to get a little extra protein in. You can even make your own shake at home, such as a smoothie, and add things with protein, such as Greek yogurt, or you can use milk as a base, and this can get you some extra protein as well in a really quick way. Something else, like I said before, is if you do have diabetes, then kind of trying to keep your glucose controlled to avoid delays in wound healing. Here you want to pay attention to carbohydrate portions and then also include in whole grains for extra fiber as well. And it's a dual effect. It's also going to help with keeping your bowel movements regular. Another thing is maybe trying to get some low-fat dairy in post-surgery. So this is going to have some really good vitamin D and calcium that's essential for bone healing. And then also just trying to get enough fruits and veggies. So the general recommendation is to get 5 per day. And so this is going to ensure you're getting enough vitamins and minerals and vitamin C. And it also, like I said prior, has that fiber in it that's going to help keep you regular.
Hello, my name is Renee Jackson. I am the nurse manager at HCA Florida Capital Hospital. Our orthopedic unit is an 18-bed unit with all private rooms. This is a feature that sets us aside from other hospitals in the area. We provide 24-hour nursing care around the clock, which consists of a nurse leader rounding, which will be provided by myself. In my absence, a clinical nurse coordinator will be overseeing your care. This is primarily at night and on weekends. We provide 24-hour nursing care around the clock. Your nursing care team, direct patient care team, will consist of a clinical nurse coordinator, a primary RN, and a patient care technician. Care around the clock includes bedside shift reporting. Bedside shift reporting occurs at the change of shift with the outgoing nurse and the oncoming nurse meeting with you at the change of every shift to discuss your plan of care and your goals for the day. Our unit has a reputation of providing exemplary patient care, as evidenced by our patient experience scores and patient feedback. Our patients rave about the nursing care and communication on the unit, the cleanliness of the unit, in addition to the professionalism of the entire nursing team. Thank you for choosing HCA Florida Capital Hospital and allowing us to provide you with a great patient experience. It's our ultimate goal to provide safe, quality patient care. Thank you for choosing us.
While at the hospital, you may experience different environments. So you may be in same-day surgery if you go home the same day, or you may go up to the orthopedic unit. If you do have sleep apnea, you will want to bring your machine with you, as it is set to your specific settings, so it knows exactly what you need and what type of therapy to give you. If you do just go to same day, however, we can just use supplemental oxygen, so it's not warranted. But if you are inpatient and you do know you're inpatient, please bring your CPAP with you. So at the hospital, you will experience pain. This is kind of knowledge that we already have. We know pain is going to be there. What we want to strive for is tolerable pain. So what do we consider tolerable pain? We still want you to do activities of daily living and get through those. So we don't want it to impede your mobility. So we want you to move around. So having no pain is an unrealistic goal, but having tolerable pain is what we want. So if we see this scale here, you see the 0 to 10. The 10 would be the worst pain that you've ever experienced in your life. So you would compare that when the nurses ask you what your pain level is. So if you tell the nurse you're a 4 to 6, we would medicate you appropriately based on that. So we actually have medication Mars that we use, and they are based on a scale. So if you give the nurse a scale of a 5, they would medicate you based on that, and usually we have a window of 4 to 6. So again, you are going to have a formal physical therapy assessment the day of your procedure, as long as you are finished before 6 o'clock. If it happens to be out of that 6 o'clock window, the nurses will get you up on the orthopedic unit. But if you do go home same day, you will have to have an evaluation before you are allowed to leave the hospital. So on the orthopedic unit, this is a communication board that we use. We do not use the dry erase boards like we used to use back in the day, where we'd write our names as the nurses and your goals for the day. This is an electronic version of that, so it tells you who your physician is, what your goals are for the day, when you've had pain medicine last, and even who the last 3 people that have been in your room. So it's a very good guide to let you know what's going on, even the time of day. Sometimes we get disoriented when we're in the hospital for long periods of time, so it's kind of a way to remind us what's going on. So after surgery, these are some of the equipment that you might see. The first is called TED hose. So that is a compression socks that actually help you from getting a blood clot. So very important. The second is called an incentive spirometer. This machine actually helps you breathe correctly after surgery. After we've had anesthesia and pain medicine, our lungs don't expand like they should. So this little machine helps you breathe correctly so that you get any junk or congestion out of your lungs, so that you can breathe adequately and that you don't get pneumonia or atelectasis after your surgery. This is a tool that you can actually carry with you and take with you home, and we do encourage you to use it at home as well. You may have a Foley catheter, which is the next image. It's not usually warranted. Most of the time it's usually inserted during the procedure and they remove it before you leave. But just if you see it, just know that that's what that is to help drain your bladder. The next image, this will be more for the hip procedures. So you will have ice packs on the unit that we will utilize to help with swelling and inflammation. Very important, but very important that we put a barrier between that and your skin so that you don't cause any skin breakdown. But you can take these home with you or use any kind of frozen vegetables or fruits at home to use as ice packs. The next image that you see here, this is called a sequential compression device, or SCDs for short. This machine actually pumps your calf muscles so that you don't develop any blood clots after surgery. So very important that we use these. One of the newer things that some of our surgeons have went to, the next image you see is a little wound vac. So this machine is for incisional wound closure. So if you go home with this machine, you may have a follow-up appointment in a week. If you do go home with this machine, you cannot take a shower until this is removed. So you will not be able to shower for a week, but you will follow up in the week with your surgeon and they will remove it and look at your incision. The next image at the bottom is called a Polar Pack. If you are a total knee replacement, you will get one of these machines. It actually velcros around your knee. It circulates cold water. So it takes ice and water to work, but it helps keep continuous ice water to your knee to help with inflammation and pain control. This is your machine to keep at home. You do not have to bring it home with you, but we definitely encourage you to take it with you and utilize it at home to help with pain control and swelling. The next image is actually what your dressing will look like. So if it's a hip, it will be a little smaller, but this is called a Mepilex dressing. This will stay on until you follow up with a surgeon. So depending on what the surgeon closes with, you will either have a wound vac for closure or you'll have the Mepilex dressing. So day of surgery, you want to make sure that you leave your valuables at home. We are not responsible for those at the hospital. If you do come in with any large sums of money or any jewelry, make sure you leave those with a family member, or if you come with no one, we will actually check those in with security. Make sure you're wearing loose-fitting clothing because we do want to actually look at your surgical sites, to make sure there's no swelling or there's no bleeding. So we want to be able to access those. But we do want you to be comfortable, so make sure you bring a robe, especially if you want to use that in the hallway when you're being walked. This can actually help you feel more at home. Just make sure it's loose-fitting and we can still access that incision site. Definitely bring your cell phones and chargers. We want you to still be in communication with everyone. So do's and don'ts after surgery, especially if you are a knee or hip, you want to plan for a bigger vehicle. You'll want to kind of use that to get in the back of it. If it's like an SUV, you may want to sit with your leg extended and even elevated with a wedge. So that can help with swelling and pain control on the way home. If you do have a surgeon that provides you with a joint replacement card, we will give that to you before you leave. So this can help with different security checkpoints if you happen to set off, an alarm in an airport or a Dollar General or wherever. So definitely a few of our surgeon utilizes those. So if they do, make sure that you get that from them and we will provide it for you. Definitely check with your surgeon, your dentist before any procedures because they may need to give you some preoperative antibiotics for those type of procedures. No driving while on pain medication. Definitely it can enhance or impede your mental status. So we don't want to have any complications after surgery. Wear any necessary braces at home that you need to, and your surgeon will instruct you on anything that you need to wear. Continue to use your incentive spirometer at home. It's very important. The spirometer helps you from getting pneumonia even when you're at home because the pain medicine can suppress your lungs. Your follow-up will be in 2 weeks, unless you have a wound vac. If you have a wound vac, it will be in 1 week. Make sure you're using large frozen vegetables if you are a total hip, or you can use the ice packs provided by the hospital, but again, we'll have to replenish those frequently. They usually only have a lifespan of about an hour or two. And things to remember at discharge, just some points to reiterate from the different communication that we've had today. You want to make sure you're eating a well-balanced diet. So with the well-balanced diet, that includes high-fiber foods to help move your bowels. Also, you'll want to make sure that you are drinking plenty of fluids and then eating foods that are very high in protein to help with wound healing. So that's very important. Make sure you're exercising as your routine is. So depending on whether you do outpatient therapy or whether you do home healthcare physical therapy, make sure you're medicating yourself before they come out to do those exercises with you and that you're keeping up with those schedules appointments because it's very important to do those exercises. Make sure that when you are on pain medication, you are not drinking any kind of alcohol as it can enhance the effects which can cause more sedation, which we do not want to do. Make sure you are not driving while on pain medications. Again, it will kind of do the same concept. It will enhance the side effects. If you have any questions or concerns, I am a guide for you. My phone number is here. This is my office number, 850-325-5376, or my cell, 850-966-0580. So when would you want to call the doctor? It's very important that we kind of know the difference, but sometimes pain medication can cause facial flushing, which can make you feel like you're running a temperature, but you may not be running a true temperature. So definitely make sure you're checking your temperature before we seek any kind of medical attention or advice. If it is greater than 101.5, that would be a reason to call the medical provider. If you have severe pain that is not relieved by pain medication, if you haven't been able to urinate in 12 hours, that is a reason that you would want to call. Constipation that's unrelieved for greater than 4 days, increased pain, swelling, or tenderness, or drainage from your incision site, which can be a sign of an infection, you would want to let someone know about that. Also, if you have any calf tenderness or swelling, which can be a sign of a blood clot, we would want to let somebody know. Now, with this all being said, these are reasons to reach out to your surgeon. If you are having a medical emergency, which we consider chest pain, shortness of breath, or difficulty breathing, you would want to reach out to 911 and go to your closest emergency facility. Again, I am a resource for you. Please don't hesitate to reach out if you need anything or have any questions. Thank you.